Hello and welcome to Module 3, Lesson 1, Personal Values in Integrated Care. This is the first lesson in Module 3 of the Integrated Care for Behavioral Health Paraprofessionals course, which has been developed by the Grow Our Behavioral Health Workforce program of the Center for Health Innovation. Purpose. Students will learn about the principles and values that underlie effective integrated care teams and reflect on their own personal values and their alignment with integrated health. Learning objectives. Students who successfully complete this lesson will be able to define values related to integrated health care and describe your current values related to integrated health. Keywords include communal values, personal values, principles, and the word values. Lesson outline. We'll start by discussing what are values, something that a word we throw around a lot in our lives, but we'd like to look a little bit more closely about what they are from a philosophical, ethical perspective. Next, we'll talk about how values drive integrated care, and then give you a chance to examine some of your own values and how they intersect with the values of integrated care. We'll recap everything with a lesson summary. I'll share with you the references used to develop this lesson. And finally, don't forget to check your understanding in the course self-assessment quiz. You may take the quiz as many times as you wish, but you must pass with an 80% or better to move on to the next lesson. Section 1. What are values? What are values? Values are the beliefs, principles, or expected behaviors that guide actions and choices. Values can be personal or communal, and sometimes the two of those overlap. Personal values are those held by individuals. For instance, honesty, fairness, faithfulness, kindness, caring, responsibility. Those are the things that we say, this is what I as an individual person value. But then there's a second type of values that we live with in our communities and our societies, and those are communal values. Communal values are held by and applied to a group. That group might be a community, an organization, or an entire society. Some communal value systems are reflected in the form of legal codes or law. At the organizational level, communal values are often structured around policy. Personal and communal values can overlap and they can affect each other. For example, an organization that's founded or run by someone who believes strongly in environmental justice reflects that individual's personal value system. Patagonia, which is a major maker of outdoor clothing, is an example of one such company. The company has grown up for years and years. The founder believed strongly in environmental justice. He was horrified at some of the things that he saw happening, especially in mountain climbing on Mount Everest. And so he decided he would create a company, and one of the core values of that company was going to be environmental justice. And he was one of the first to start making clothing out of recycled plastics. So when you buy Patagonia, that you are also supporting those values. So that's just one example of how an organization can be reflective of an individual's value system. In this lesson, you will learn about the connection between personal values and integrated care. You will also have a chance to examine your own personal value system. Communal values of integrated care will be discussed in our next lesson. How do values drive integrated care? What do personal and communal values have to do with integrated care? Everything, 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 and everything. They are what underlie all that we do, every decision, every idea that comes up, every workflow process, everything that's changed about the way we deliver healthcare is based on the things we value. Healthcare is delivered by a team made up of individuals, each of whom brings a set of personal values to the task. Integrated care is based on communal values such as cooperation, coordination, wellness, and efficient use of resources. For integrated care to be effective, these communal values must be shared by individual team members, management, organization, and policymakers. To understand values, we're going to start a little bit about that by talking about the 5 principles of team-based healthcare. And these principles come from a report developed by the National Academies of Medicine titled Core Principles and Values of Effective Team-Based Healthcare. The link to that report, if you're interested, is in the references. And that report described the 5 principles of team-based care, which were introduced in Module 1. Definition time. A principle is a rule, belief, or guideline that guides actions. And so we'll differentiate between principles and values. Here are the 5 principles of team-based healthcare with a little more discussion than we did in Module 1. First of all, shared goals. The team, which includes the patient and, where appropriate, family members or other support persons, works to establish shared goals that reflect patient and family priorities and that can be clearly articulated, understood, and supported by all team members. So a fancy way of saying everybody shares a goal and we're really clear about what those goals are. So once we say them clearly. Clear roles. There are clear expectations for each team member's functions, responsibilities, and accountabilities, which optimize the team's efficiency and often make it possible for the team to take advantage of division of labor, thereby accomplishing more than the sum of its parts. That's a fancy way of saying that everybody has a job and everybody gets to do that job. And once we have the entire team, all jobs are accounted for. So nothing is left out, but we actually create something that the team as a whole can do more than any one individual could do if they weren't working together. Mutual trust. Team members earn each other's trust, creating strong norms of reciprocity and greater opportunities for shared achievement. We've talked a little bit about interdependence and integrity, and those are the things that underlie the mutual trust that team members need to have for each other. Effective communication. The team prioritizes and continuously refines its communication skills. It is consistent channels for candid and complete communication which are accessed and used by all team members across all settings. Those are the things that we have introduced earlier, the idea of both communication infrastructure and communication skills. So those communication skills are essential to the team functioning well. And finally, measurable processes and outcomes. The team agrees on and implements reliable and timely feedback on successes and failures in both the functioning of the team and achievement of the team's goals. These are used to track and improve performance immediately and over time. So the team basically says, we are going to track how we're doing. Are we really helping this patient? Are we working in the most effective way we can? Is the care we're delivering cost effective? Are patients satisfied? So they're going to be tracking all of those different things. Those principles depend on the personal values of healthcare team members. And the 5 personal values that have been identified in all this research, and as we go through this, I'd like you to check in with yourself and think about, are these things that you too value as a team member? Honesty. Team members put a high value on effective communication within the team, including transparency about aims, decisions, uncertainty, and mistakes. Honesty is critical to continued improvement and for maintaining the mutual trust necessary for a high-functioning team. So you see how this value of honesty that you as an individual team member bring to the team actually underlies those principles that the team enacts. Discipline. Team members carry out their roles and responsibilities with discipline, even when it seems inconvenient. At the same time, team members are disciplined in seeking out and sharing new information to improve individual and team functioning, even when doing so may be uncomfortable. Such discipline allows teams to develop and stick to their standards and protocols, even as they seek ways to improve. In other words, everybody is committed to doing their work and doing it well. And when they see something not going well, even if it's their own responsibility, to improving it. This is the type of discipline that's required to provide the best and the highest quality care. Creativity. Team members are excited by the possibility of tackling new or emerging problems creatively. They see even errors and unanticipated bad outcomes as potential opportunities to learn and improve. On a team where everybody values creativity, it's not about blaming or fault. It's about how can we come up with creative solutions to the many, many challenges of helping people get better. Humility. Team members recognize differences in training but do not believe that one type of training or perspective is uniformly superior to the training of others. They also recognize that they are human and will make mistakes. Hence, a key value of working in a team is that fellow team members can rely on each other to help recognize and avert failures, regardless of where they are in the hierarchy. And as you know, healthcare is one of the most hierarchical, has traditionally been one of the most hierarchical industries in which to work. We have, for many years, not valued the input of all team members. But no matter what your role is, if you see a mistake being made, and no matter what that person's role is, it is up to you to say something. And it is up to that person to accept that correction with the understanding that we are all only human. And finally, curiosity. Team members are dedicated to reflecting upon the lessons learned in the course of their daily activities and using those insights for continuous improvement of their own work and functioning of the team. So simply being curious. You put on your Curious George hat and look at how could we make things better. I'm curious about what would happen if. So what's the relationship between values, principles, and integrated care? Well, we know that for integrated care to be effective, those 5 principles need to be followed. Those are the guidelines for the care. And those 5 principles, in turn, rest on those 5 values that every individual on the team needs to hold. So it depends on the team member's commitment to those values. So without the values, we can't have the principles, and without the principles, we can't have the care. So the values underlie all that we do. So we've been talking generally about values, and what we know are the values that makes integrated care effective. Lots of people have done lots of research, there's been lots of discussion, but right now we know that's really what drives those effective teams. So here's a question for you. What are your values? We all live by a set of values. Some are recognized and spoken, while others are unspoken. Those values influence our choices about where we live, what we eat, how we interact with others, and the careers we choose. By defining your personal values, you discover what's truly important to you, especially as you move forward in your career as a behavioral health paraprofessional. So I'd like you to take a moment, and if you have not done this already, step back and assess your own values and see how they align with the 5 values of integrated care. So first, let's pause to think about your life. Was there a time when you felt really good? You just felt confident that you were making good choices, you knew you were on the right track, and whatever it was that you were doing was just right. After you pause for a moment, take some time to answer the following questions. Pull out a piece of paper so you can write down your thoughts. Step 1. And please pause the video as you need going through this. What makes you happy? Find examples from both your career and your personal life. What were you doing when you were just feeling happy? Were you with other people? Who? What other factors contributed to your happiness? Where were you? What were you doing? What was the atmosphere? Who was around? Step 2. And again, pause the video to write down some answers to this question. What makes you proud? Think about your experiences in school, your career, and your personal life. What makes you proud? Why were you proud? Did other people share your pride? Who? What other factors contributed to your feelings of pride? Maybe you taught your dog how to heel on a leash really well and you felt proud of that. Maybe you graduated from high school or college. Maybe you completed a course. Maybe you ran up a mountain. What was it that made you just feel proud? Your values, step 3. Identify your top values. Again, pause the video so you can spend some time with this. Take a moment to reflect on the experiences that you've just identified. Why is each experience truly important and memorable? What about that experience made you feel happy or proud? What were the underlying values that made it such a special moment for you? Next, use your answers to select your 10 top values. You can see the list in Module 3, Lesson 1. If you look at the HTML page, take a look and there's a big old long list. Out of those, select 10. After you've selected your values, prioritize. Narrow it down to your top 5, because you should have 10. And here's how to do it. Again, pause the video to do this exercise. Out of the 10 that you've chosen, which 5 are most important to you? Pull out another piece of paper, write down your values, not in any particular order. Create a word cloud, just writing them randomly around the page. Select any 2 of those values, and then ask yourself, if I could choose only one of these, which one would I choose? It might help to imagine a situation in which you would have to make that choice. For example, if you compare the values of teamwork and independence, imagine that you must decide whether to write a novel or work with a team on a scientific discovery. Keep working through the list, writing down your choices until the list is complete. Combine any values that go together. For instance, if you value philanthropy, community, and generosity, you might say that service to others is one of your top values. Review your top choices. Do these values make you feel good about yourself? Are you proud of your top 3 values? Would you be comfortable and proud to tell your values to people you respect and admire? Do these values represent things you would support, even if your choice isn't popular and it puts you in the minority? Take some time to work with this prioritization step. Finally, now that you have your 5 values, your 5 personal values, I'd like you to compare them with the integrated care values that we've just discussed, of honesty, discipline, creativity, humility, and curiosity. Do your personal values line up with those of the integrated care team? Which match? Which don't match? Could you develop a sense of ownership for the values of integrated care that don't match yours? Lesson summary. What are values? What are values? Values are the beliefs, principles, or expected behaviors that guide actions and choices. Values can be personal or communal. How do values drive integrated care? Healthcare is delivered by a team made up of individuals, each of whom brings a set of personal values to the task. Integrated care is based on communal values such as cooperation, coordination, wellness, and efficient use of resources. For integrated care to be effective, these communal values must be shared by individual team members, management, organizations, and policymakers. Here are the 5 principles and 5 values of integrated care. The 5 principles are shared goals, clear roles, mutual trust, effective communication, and measurable processes and outcomes. These principles depend on the personal values of team members. These 5 values are honesty, discipline, creativity, humility, and curiosity. You've had a chance in this lesson to reflect on your own values. We all live by a set of values. Some of those values are recognized and spoken, while others are unspoken. Values influence the choices we make about where we live, what we eat, how we interact with others, and the careers we choose. By defining your personal values, you discover what's truly important to you, especially as you move forward in your career as a behavioral health paraprofessional. During this lesson, you've had a moment to take a moment, step back, and assess your own values and see how they align with the 5 values of integrated care. References for this lesson include the following. Note the second reference, Mitchell et al., is the one that I've referred to multiple times in this paper, or in this lesson. Don't forget to check your understanding on the lesson self-assessment quiz. You may take it as many times as you wish, and you do need to pass with 80%. The Integrated Care for Behavioral Health Paraprofessionals course has been developed by the Grow Our Behavioral Health Workforce program of the Center for Health Innovation, with funding from the Health Resources and Services Administration. Thank you for your time.